What is interprofessional collaboration? Interprofessional collaboration is when healthcare providers from different disciplines work together to develop a plan of care centered around and including the patient.
That's right. And multidisciplinary refers to a team or collaborative approach where members of different disciplines assess or treat a patient individually and then share their knowledge.
Hi, Mr. Belvin. My name is Ken. I'll be your nurse for today. And how are you doing?
Going for surgery, so not so great.
Oh, do you mind asking you a few questions about your procedure?
Sounds good.
So you're having left knee surgery, correct?
Yes.
And do you have any health conditions that we should know about?
Yes, I have diabetes and high blood pressure.
Oh, so hypertension.
High blood pressure?
And what's your living situation like? Do you live by yourself, with a house?
I live with my wife, Sarah, in a 2-story townhouse.
Okay, so we need to contact the OT.
OT? Okay.
Your surgery is scheduled for next Thursday. Please be here at least an hour early. In terms of your actual surgery, it'll be 2 hours long and you'll be given general anesthetic. Are you allergic to any drugs?
No.
Do you have any health conditions I should be aware of?
I told the nurse already. I have diabetes and hypotension. He said he put it on the chart.
Do you have anyone to take you home after surgery?
Yes, my sister. How long do you think I'll be here?
Oh, you'll be on the next day. Anyways, I think I'm done here. Do you have any other questions?
Where would I find physiotherapy?
Actually, just go out there. The secretary can direct you. Well, it's nice meeting you again, and I'll see you Thursday.
Okay, thank you.
Hi, Mr. Belvin. Hello. Hi, I'm Jason, your physiotherapist.
And I'm Andrew, your occupational therapist.
Great. So you're having knee surgery. Which knee was it again?
My left?
Ah, okay. And do you have someone to pick you up after the surgery?
Yes, my sister.
Well, okay. You're going to be here for 2 to 3 days after your surgery. During your stay, we'll be working on strengthening exercises and dressing yourself. It was nice meeting you. We'll see you next week.
I thought I'd be going home the day after my surgery.
Actually, according to our procedures, you are going to need about 2 to 3 days to recover.
I think we're done here.
Yeah, okay.
See you next week.
I've been here all day, waiting for everyone, but no one's listened to me. I said the same thing over and over again. This is ridiculous. Like, when am I going to be going home? Everybody said something different. Who do I believe? I hope they get their act together before my surgery. I can't believe how unorganized they are.
My perspective about the process that a patient goes through in our present healthcare system has developed from my advocating for and with my parents and family members as they required the skills and expertise of various healthcare providers. The journey usually would begin with the family physician, and then it would transpire into a number of tangents or spokes on a wheel rather than any organized plan or strategy. This required a great deal of time and energy on the part of the individual and their family members in order to schedule appointments, confirm appointments, arrive at appointments, collect any and all information provided at the appointments, and even to establish next steps. But sometimes, but not always, were they provided by the healthcare system. Education, follow-up, and coordination of care truly seem to rest with the individual and their family throughout the continuum of care. The involvement of oncologists, neurologists, gerontologists, occupational therapists, pharmacists, etc. became separate journeys that required the individual and her family members to initiate, navigate questions, probe and assimilate information on their own, and I often thought how blessed we were and were able to have the ability to persist in finding answers, to be able to question and ask for options and other possibilities, and on our own to delve into what was and is available to our family members in need of help. Connecting healthcare providers, pathways, information, and options would be extremely beneficial to patients and their families. It often seemed that we were trying to connect the dots on our own and that we were trying to discover next steps on our own in the healthcare system. That we were charting a new frontier and a system that could work for and with us to provide the care we needed. Having an individual in the healthcare system go out of their way to connect with us and or to assist us was more often the exception than the rule. We experienced a wealth of knowledge, skills, and compassion by many of the healthcare providers we came into contact with, but it felt like we were pulling the load when it came to education, the transference of knowledge, and to put the pieces together in order to achieve the health picture of any one of our family members in need. I truly believe this was and could be seen by other families as a very daunting task, and one that few in our communities are prepared for when the time actually comes. The healthcare system needs to redirect the tangents of care that occur. It needs to put the spokes on the wheels into a circle of confidence for patients and their families, and it needs to develop pathways that function as a network to support and care for individuals and their families in need of the vital services that our healthcare provides for us. Thank you.
So Dr. V, I understand that you've met with the patient and ran some tests. Is there any other information you need?
I looked over the results. Everything seems to be fine. All I need now is the health history before I go into surgery.
Good, I'll take the health history and put in the chart.
Okay, so now that that's done, have we decided on a discharge date yet?
24 hours is sufficient.
Based on his previous surgeries, I think he's going to need more than just 1 day.
Yeah, I think he'll need around 3 days for him to recover under our supervision.
That'll also give me enough time to do a home assessment if necessary.
Alright, so he'll be stable in 24 hours, but I guess the extra 2 to 3 days will allow him to rehabilitate under our care. So I'm fine with 2 to 3 days.
Okay, so we've agreed that the patient should stay for 2 to 3 days depending on how he recovers after surgery. So Ken will take the health history and record it. Andrew will decide whether a home assessment is necessary. And Jason will be responsible for help with recovery and rehabilitation.
Hi, Mr. Belvin.
Hello.
I'm Nicole. I'll be your coordinator for your care plan. So how are you doing?
Getting a bit anxious.
Well, Ken here will be taking a health history for you, and I'll be here to answer any questions you might have.
Okay.
So I was going to ask a few questions about your health. Are there any health conditions that we should know about?
Yes, I have diabetes and high blood pressure.
Oh, do you have type 1 or type 2? Well, that concludes our interview right now. Nicole, our case coordinator here, will take over any questions that you might have.
Okay, thank you.
Thanks, Ken. So I'll start off with a basic layout of your day.
Okay.
You'll be arriving at the hospital about 9 a.m.
Okay.
And you'll be checking in at that time at the pre-surgery desk.
Okay.
So at about 10 o'clock is when your surgery will take place. And after that, you'll be out of the surgery at about 12 o'clock in the recovery room.
Okay.
At about an hour later, you'll be in the surgical daycare, and you'll be staying there for about 2 to 3 days.
Okay.
And then you'll be seeing Jason, our physiotherapist, and he'll be helping you gain the use of your knee. And after that, you'll be seeing Andrew, our occupational therapist. He'll help you get back to your daily activities, such as climbing the stairs and getting yourself dressed. You mentioned earlier that you live in a 2-story home, right?
Yes, it's a 2-story townhouse.
Okay. Well, Andrew might need to do a home safety assessment then. Is that all right with you?
Sure.
Okay. And do you have any questions for me?
Yes, I'm a vegetarian. Can I speak to somebody about my diet?
Oh, sure. I can arrange an appointment with our dietitian, Victoria.
Great, thanks.
Okay, well, you're welcome. If you have any more questions, please don't hesitate to contact me, okay?
Okay.
All right, I'll see you on Thursday.
Thank you.
Interprofessional education is when 2 or more professionals learn with, from, and about each other to improve collaboration and quality of care.
LIHSA exists to help promote interprofessional education to students hoping to work in the healthcare system. To achieve this, we host events to learn about interprofessional education and to learn about the different roles within the healthcare system. We also provide volunteer opportunities and placements to students to work in the community.
We believe that by promoting interprofessional education and collaboration, we can influence our healthcare system by improving communication amongst professionals, improving quality of care, and realizing a full scope of practice.